Hey, Dr. Malone,
Yes,
how are you today?
not bad yourself.
I'm doing okay. Um, you know, I've lost count as to when we started these videos. I do think it was sometime in mid-March. It's now
July.
mid-July, right? And back in mid-March, we were talking about how this seemed to be a problem that was elsewhere, and um, we were watching places like New York, New Jersey, have significant problems with the virus. And we were talking about it being sort of in an abstract almost, except for the nursing facilities here. And now, of course, things have changed dramatically. We now are the epicenter for the world, Florida that is, for the virus. So she was on the other foot, right? Um, uh, Still, people, I think, look at the news and they still don't really get the whole masking thing. You know, from the top of our state government to the top of our federal government, we don't have a consistent message on masking like we've been saying since March. I have asked you periodically to pull up, and you have every one of these videos pulled up the latest scientific medical articles that discuss various things that we feel like might be of interest to the local community for their own health and safety. So I know that you've pulled some things today, and I'd like for you to share those with our audience, if there is any
Sure,
audience.
sure.
Sometimes there is, sometimes there's not. But if you could tell us what you've got, and hopefully we can help some people in
Absolutely.
the local community.
Yeah, and we'll, as always, we're going to share all the links with what we've got here, folks. The first thing here, I guess, that this showed up on Mayor Robinson's Facebook page this week. A graphic just showing basically over the last month, the daily, how many people are hospitalized during a given day of the month. And I think you'll agree with me that back in March and April when we were talking about this, it was single digits in the entire county that we were talking about, like, hey, that's probably what's in the hospital, and they're only publishing like the cumulative data. So this is hospital reported from the hospitals in the county, and it's tabulated. So it's a pretty impressive graphic, which should kind of let people know, hey, the impact is there, at least in the hospitals locally here. So as much as we say that the young, healthy people may be asymptomatic or may just have like, a vague symptom that they can do, do away with, these are plenty of other people that are sick and being hospitalized from it. So that was something that I think that was pretty telling. And then your mention of the epicenter, so that's timely in that today, governor's report came out of the White House, and Florida.
Wait a minute. You said two things that make me question what you're getting ready to say next. The governor's report came out of the White House.
It was entitled the governor's report, like to the governors. That's the way I read it. And so I guess the way I also saw this come through on my newsfeed is that this is a leaked document. Well, it's out there. And so for the state of Florida, if you zoom in here, here's localities in the red zone. And the top 12 in the state are listed, and Pensacola is one of the top 12.
Well, how do they know exactly what parts of Pensacola? Like, that seems strange. Like, they have Miami, Fort Lauderdale, Pompano Beach, and then they have Pensacola, Ferry Pass, Brent. Like, that's a certain area of town.
I think it's zip codes based on where the testing is being done, because that's what they were releasing. I mean, it's so granular where you can get down into the different zip codes. So for instance, the zip code for Pensacola Beach, the island, it's like almost had like 0 cases basically.
So what does this mean, Evan? What does this mean? What does it mean to be in the red zone, according to this document?
Well, so at the bottom down here, and I don't know if you'll be able to read it, it says there are counties that during the last week reported, it's basically their, let's see here if I can, reported both new cases above 100 per 100,000 population and diagnostic test positivity of above 10%.
Yeah, we've had that.
Yeah. So in the state, there's 22 locales that meet those criteria, and one of those 22 locales in the entire state is one, I guess, little zip code of Pensacola, but it's here. So
But it's pretty much all the big cities in Florida.
Yeah,
Yeah.
exactly. And those are the same big cities that we've always said, hey, those are the counties, the Dade, the Broward, the West Palm, all that kind of stuff that we're racking up. When we have 500 cases in a day and they have 3,000, we're hanging in with them still, that we're one of the hot spots.
Right.
So I thought that was also telling, and we'll link that full report where it lists nationally all the hotspot states, and then within each of those states, it was shared online. So we got a link for that we can share for you guys if you're interested in looking into if you have any family or friends elsewhere. And then the city of Pensacola came out with a dashboard this week. I just thought I'd share that real quick. This is a screenshot from just about an hour ago. And I guess the status of the different services being green means that they have enough personnel to keep running, the fire department, the police department, and dispatch. And back when, if you recall, they said they're going to have a red, yellow, green system to help dictate what they need to do locally. Is going to be based on these resources. So if half the police department calls out sick because they have the infection, then obviously that's not going to be green anymore. So anyhow, for what it's worth, the city's got a dashboard up. Not a whole lot of data on here, but it's something you can go to just for a quick glance.
Is the percent positive of that green graph? Is that saying that it's leveled off somewhat, I guess, in the last week? Or am I
yeah, and I can show you a better graphic of that. So it's at 10% and it's probably up to about 13.5% and then back down. And to give you a better look at
the city's in the yellow now as a whole. That's what it said, right?
Yeah, here, let me go back to that for you. Here you are. So
and what are you looking at? Yellow because of the number of positive residents, 4,700 in the county.
Yeah, I don't know I don't know if that yellow means the city's in the yellow, or if they just made it that.
No, but it says city of Pensacola.
Oh yeah, up at the top left. Okay, yeah, I see what you're saying. Yeah. So it's yellow status. So basically, my understanding of their red, yellow, green is that at yellow, they ain't going to the next phase. They're either sticking in this phase or regressing back to phase 1 or what they're in. It's definitely not moving forward when it's yellow.
Okay.
That's my understanding of it. Sorry about that. I misunderstood. We were looking at that was yellow. Other stuff that I found that was interesting. Let's see here. This is kind of moving out of the local stuff. So the publication, the most important and erroneously reported vital sign in medicine is actually now, according to some physicians, turning out to be the most important vital sign. And which one do you think it is? You have body temperature
or pulse ox.
Okay, so here's the ones that most people: body temperature, heart rate, respiratory rate, white blood cell count as far as like a sign of infection, and then pulse oximetry. This gentleman here says it is the respiratory rate.
All right, and why does that matter to us?
Because these, in the context of having an infection, these people show up and I guess candidly, as a physician or a nurse, it's almost a joke that the respiratory rate, everybody's got a respiratory rate of always 12 or always 16, and it's just something that gets written down and not accurately counted more times than not in a hospital setting.
Oh.
Unless of course, like they're on a machine that is measuring it for them. But if it's like someone's taking your vitals, they'll just kind of watch you breathing and multiply by 4 if you do it for 15 seconds. So it's not always the most accurate predictor. Anyhow, this is this physician's saying we should be paying more attention to it and should be measuring it more accurately in the emergency department setting, because this may be a sign that, hey, this person can't be triaged to home just yet. Maybe they need to be observed, because
so
even though
if somebody's breathing, what is the respiratory rate if they're at home and they're thinking about going to the ER and they think they may have a problem, and they, maybe they don't have fever, maybe they do have fever, but it's not really that bad, and they're starting to have shortness of breath. Where does their respiratory rate, how would they measure that at home? Is that something they can measure themselves or not?
Yeah, they can. So it's breaths per minute, and naturally when you're measuring your own breaths in a minute, you're going to either breathe more or less than normal. You're watching that clock go, right? So you really want someone else to measure it for you when you're not really paying attention or you don't know it's being counted. But you'd like to be ideally under 20 a minute, and that's based on someone's age. So,
and is a breath, are you counting every inhale or exhale or both? I don't understand.
the whole cycle of an inhale and exhale is one breath.
Okay.
Okay. So inhale, exhale, 1, inhale, exhale, 2, inhale, exhale, 3. And
Gotcha.
so, and if you're marching above 20 pretty consistently, and you're also maybe not feeling well, that'd be a sign that, hey, maybe there's something going on. And it's not specific to the virus. It means that you're having some respiratory difficulty.
Right.
So there's people that have gotten thermometers at home. They've got pulse oxes at home. Well, your respiratory rate can be counted on your own, but make sure you do it accurately.
Okay,
So,
good advice.
and doctors and nurses are again, notorious or staff in facilities where they don't always count it accurately, I don't think. And it's just like the leftover vital sign that gets added. That's the one you fill out last.
Right.
And so there's a shift in focus now. So in thinking of, if you need to seek care, it's something that the doctors are not doing lightly with. So now there's some companies out there that are thinking that we can filter air with basically super hot metal coils, and they can kill 100% of the virus, in a building, basically, by deploying these in the building. It's like a nickel foam based filter. So the idea is that these things would be in some of you wouldn't have one in your home necessarily, or even in an office building right away. It'd be more for nursing homes and hospitals. And, if these things got rolled out, they'd be tiering them out appropriately and then retrofitting some buildings to get this in there. So it's one thing that's being thought of as far as, hey,
so this system would heat the air as it comes in from the return.
Yep.
How many degrees?
200
degrees Celsius?
Yeah.
I don't know what
I mean,
what's that Fahrenheit?
That's like almost 400 degrees Fahrenheit. So yeah, it heats it, it kills the virus, and then puts
and then if it's part of the AC system, it would have to cool it down from 400 degrees to 60 or 65 degrees and then blow it out.
Yeah. And so they're saying that right now air conditioning systems are potentially a threat for spread.
Yeah.
The virus does good at that temperature. 70 degrees is like where it loves that, right?
Right.
So it go much above that and it doesn't tolerate it as well. So the idea is you heat this stuff up and then put it into your HVAC system after it's been basically sterilized. So it's out there, and there's engineers. These are non-medical people. These are engineers and biopharma people that are trying to come up with ways to how they can contribute this back to functional. I mean, and you and I both know firsthand that it's frustrating not to be able to be working in the office, and
Right.
testing is there, but it's not ideal. So what else can we do besides having people mask up and use hand sanitizer?
Put them in the oven.
Yeah, exactly.
Right.
And then onwards to the vaccine. Next Tuesday, the Oversight Committee for Energy and Commerce in the House is going to be having their hearing for the summary from the big 5 companies that are working on the vaccine. So I'll look forward to that, and hopefully we get some useful information that maybe we can share with you all. So that's on Tuesday. I'm sure it'll be something that's like on C-SPAN or whatever if people are interested in tuning in. Just to kind of watch this thing in real time updates, and hopefully that's an update that you're getting right from these companies and not that's been manufactured in any way through different outlets or whatever. This is coming right from the folks being asked by your representatives. So I thought that'd be something that would catch people's interest. And let's see here, what else? This was, so the CDC is publishing some seroprevalence. So we talked about seroprevalence being, hey, we got to get to like 50 or 60% before we're talking about herd immunity, right?
Right.
So they grabbed some spots around the country, and this is as of June 25th, so just a couple weeks ago. And New York metro region, the seroprevalence that they've estimated with this is they're not even at 7% yet. And that was one of the hotspots.
Wow. So only 7% of the people in New York have the virus or had the virus?
No, they have the serum, the antibody.
Okay.
So
to get herd immunity is like 70% or something? 70, 80%?
It's between 50 and 70, depending on. And then here's South Florida. We've been sitting here staring at the South Florida numbers ballooning for the last like 2 or 3 weeks, right? they're less than 2% seroprevalence.
Yeah, but
I
that
mean,
was for samples collected from April 6th to April 10th, though, right?
yeah. So, but still, so it's been ballooning. But to know they started at less than 2%, there,
So
anybody who thinks,
it's
yeah,
probably at 3 or 4 now.
yeah, anybody who thinks herd immunity is coming without vaccination is a added stimulant is mistaken.
Pipe dream.
So
Okay.
yeah.
So and the Dr. Malone red, yellow, green. Let's use that since that's the thing we talked about with the city.
Yeah.
Where if you were at a green, I don't know where we probably never were at green. Where were you in March? Red, yellow, or green?
Well, at the outset, I think we all started at green because we didn't really understand it, and then by the end of March, we were probably at red. I mean, we were locked down. Yeah.
Where did you go in May? April, May.
April and May, I think probably transitioned into yellow, and was in yellow. We were in yellow, I would say, a personal level of yellow until, gosh, what was it? 2 weeks ago now that we've come back to doing, everybody's working at the home, and so I haven't seen you in however many weeks it's been now in person, that is.
Right.
And then it's still like, if I go out and run errands, I got my mask. It's right next to my car keys with the bottle of hand sanitizer.
Where are you now?
At my home.
Red, yellow, green.
Probably between yellow and red, I guess.
Okay.
I mean, red would be, I guess, personally, like, where I wouldn't be leaving the home at all, like it was, I guess, at the end of March. So
why do you think we shouldn't be at red right now?
Well, I think you could be at red depending on your role, what role you are and what kind of cog you are in society. So you could be at red or you could be at yellow. I don't think anybody should be at green. So if you're someone who's able to work at home, then yeah, you're going to be naturally yellow. If you have to go out and you're working at a hospital, you're working in public service, or you're a first responder, I mean, you're red, really. I mean, even though you're going to your job, I mean, you are on the front lines, and you need to be doing that whole thing where every time you come to your home, you're disrobing in the hot spot of the home and leaving your clothes behind, getting rinsed off before you spend time with your family members or loved ones. I'd consider that red when you're going to that extreme of trying to quarantine yourself when you're not at work. So it's probably between yellow or red, depending on the situation, really, or the task. But truthfully, there's not a whole lot of places that I've personally been going. I mean, it's work during the days, as you know, and then really cooking at home and go to the store once a week.
Right. Okay. Well, I guess we'll watch it over the weekend, watch the numbers. My concern is, again, you go out to the beach and you see tags from all over the country still, to make that drive in the summer most every day. And it's Tennessee, it's Alabama, it's Georgia. It's typical Southeastern states visiting the area. Mm-hmm. And, if you have reservations at a hotel and the beach is open still, you're not going to cancel those reservations because they're going to charge you anyway, right? So you're going to come, the beach is open. The county hadn't decided to close the beach, which I disagree with, but it hasn't. And everybody's coming from all these places. And, I'm not sure that we're going to control the virus to any extent unless we're in red again, right? And so we're a hot spot for the state. And it seems like to me that unless you're doing your own masking, distancing, that kind of thing, and making sure you remove yourself from the public if you have symptoms, and get tested immediately, and then let everybody know that you came in contact with, that you have the virus if it turns out to be positive, which is sort of your own self contact tracing. Mm-hmm. I don't know how this gets better. It gets worse before it gets better.
Yeah, and right now we are getting worse before we're having a chance to get better. So I think if we're going to follow that trajectory, it's going to peter out at some point, but it's not the petering out; it's the going back down.
But it won't peter out though until
or plateau.
Right.
Yeah.
Yeah. I don't know. you know, the virus like just wants to keep jumping from host to host, right? It wants to keep going. So, and anyway, we'll watch it over the weekend. We'll be back next week, sooner if necessary. We appreciate you pulling all that stuff, Dr. Malone. Thank you very much for your words of wisdom, medical wisdom. Folks, if you have any questions about any of this or any other personal injury matter, you can find us on the web at zarzaurlaw.com. 855-HIRE-JOE is the phone number. Y'all take care and be safe this weekend. Distance and mask. Okay? Thank you, Dr.
Bye
Malone.
now. Yep. Thank you.